First responders have been experiencing a worker shortage over the last few years, and leaders are now calling it the worst they've seen. State EMS leaders have even asked for an extension of emergency regulations to help with shortages.
Those regulations were changed during COVID to ensure adequate ambulance staffing. Now, LEX 18's Rachel Richardson talked with those in charge about what's needed and what's being done in this LEX 18 in-depth.
Imagine being in an emergency, dialing 911, and no one comes. There's a shortage of emergency responders in the U.S. and in the bluegrass state. One emergency medical leader in Jessamine County serving for more than a decade says the shortage is the worst it's ever been.
In Kentucky, I would say that it's approaching crisis level.
Jessamine County's leaders say they have enough people on staff, but things could change at any time. Over the past few years, they've had to adjust their service model from Plan A, having a paramedic go out on every call. But right now
we're in Plan B, where we don't have a paramedic on every ambulance. We have a paramedic on quick response vehicles, and they get dispatched to you. But on occasion, if we don't have enough paramedics, then likely you're still going to get advanced life support care with an advanced EMT.
There is no Plan C. Essentially, workers want better hours, better mental health, and better pay. A Kentucky Board of EMS 2019 study shows that EMTs' average pay is $11.88, and advanced EMTs is $13.30, and a paramedic $15.62.
It's becoming difficult to retain and keep and recruit employees if you don't have a healthy work culture and you don't have a good compensation package.
Jessamine County EMS takes between 9,000 and 10,000 calls each year, and these leaders say there's not enough training across the state for new paramedics. The Kentucky Board of Emergency Medical Services reports that 57% of Kentucky's more than 14,000 emergency providers are affiliated with the service. More funding for EMS could mean lower service bills after you dial 911.
We've got to think about the cost of operations, and if we decrease the cost of operations, we could potentially decrease the cost of, cost to the end user.
The U.S.'s population is aging, and more people are battling chronic health conditions. In an emergency, it's hard to imagine not having an EMS response.
If we keep going down the route that we're going across the country and across the state, we're going to see them leave. We're going to see them choose. Some of them are just leaving the industry altogether. They're tired of health care. They're burnt out, and we have to do something about it.
These leaders are looking for a solution in the bluegrass to a national problem. In Jessamine County, Rachel Richardson, LEX 18 News.